Hey everybody, Glenn Hausman here along with Anthony Melchiori. We're doing a very special live episode today. Anthony, today we have Dr. Michael Osterholm on the show, one of the leading infectious disease folks, just named to Biden's task force on COVID. I'm so honored to have this gentleman on today to really cut through the clutter and let us know what is really happening out there today.
And today is a day that I really have him on because yesterday we had 402 cases, which is triple the number of cases since the last time he was on September 4th. So pretty serious numbers. So let's get to it. Have him on, and it's an honor to have him on.
All right. Dr. Michael Osterholm, welcome back to the show, sir. We really appreciate you taking the time to speak with our hospitality-focused audience. Before we get started, just want to say Dr. Osterholm has the Osterholm Update COVID-19 available every single week on Thursdays. Please go to osterholmupdate.com, or, of course, you can find it on Apple Podcasts, Spotify, and Google Play. It's the best way for you to understand exactly what's going on. Again, sir, welcome to the show. What do we need to know right now today on November 13th?
Well, first of all, thank you for having me back. That's a great statement right there. I'm very
Hey, it's a great statement you would come back. So thank you so much for treating us.
You guys did a great job last time. It was very, very thoughtful. I think the message that unfortunately we need to share is we're in bad shape. This is the darkest part of the COVID pandemic, and it's going to last until well through the holidays, into our availability of vaccine early next year. And I think we have to wake up to that fact and understand if we don't change our behaviors, these case numbers at 160,000 we see today are going to climb much, much higher than that. Our hospitals are going to continue to not only be overrun, but overrun in a way that we could hardly imagine. So, and it's up to us. It's up to us against this virus.
Right. It definitely is. So at this moment in time, I saw your interview just the other day where you're talking about a 4 to 6 week national lockdown. I don't want to get into the political side of things. I'm sure that stuff will be negotiated and how people will get paid. But why do you recommend that lockdown? What do you hope it's going to achieve?
Well, first of all, I would really hope we could avoid using the term lockdown because as I said, if you interview 50 people, you can get 75 different definitions of what it is.
Of course.
And I think that the challenge is how are we going to reduce cases? Mm-hmm. And, if I'm in the hospitality industry, is a good example, I would have really concerns about limiting, what goes on in your business. On the other hand, if in fact these cases continue to climb like this, nobody's going to be going to the hospitality industry to begin with in terms of spending their entertainment and food consumption dollars. Mm-hmm. So what we have to do is find a way to maximize one for all. And I think the most important message I could give is that we do have this window for hope. And it's a window that says we are going to have vaccines that will likely be very safe and effective even as early as towards the middle to the end of the first quarter next year. So we're not asking people to do this forever. This is a situation where we really are in a COVID year. It's not going to be like last year, and it won't be like next year, hopefully. But for the time being, we're going to have to go through this. If we see cases get well north of 200,000 a day, hospitals will be literally overrun. I said that before, and I just want to emphasize that because as goes hospitals, goes our communities. If it's not just a function of COVID, where we'll see increased number of cases and many deaths, but even just something as simple as heart attacks and strokes and in cancer treatment and all the things that we require healthcare delivery for will be seriously challenged. So we've got to take this on. And the first step is recognition. And I would just close it by saying that, I've always believed it wasn't my job to scare people out of their wits. It was my job to scare them into their wits. And that's what we need to do right now.
That's right, Anthony.
So if we can talk about the vaccine, where are we with the vaccine? How hopeful are you about the vaccine? And let's talk through that a little bit.
Well, I'm actually quite hopeful in the sense that, the early data looks very promising in terms of the protection it provided people, with a 90% efficacy in the first vaccine study reported out. Now, we have more to learn about that. We need to find out, first of all, was that a situation where it prevented 90% of fever, cough, and chills, or does it prevent 90% of severe disease? hospitalization and maybe even death. We'll learn more about that over the days ahead. But even the fact that we could prevent 90% of something with this disease is a really important point. We'll also learn more about how long it lasts, the protection. Is it something that lasts just for 12 months, 18 months, whatever? Remember, the data that were included in the submission to the FDA actually only had data through 2 years, through 2 months worth of follow-up after the vaccination. So we're going to want to know more about that too.
So once they approve it and they say, okay, we're going to use it for emergency cases, what can we see? What's the timeline in your estimation of actually getting approval, starting to use it for emergency cases, and then getting it to our frontline workers and then potentially getting it to every American? What are we talking about?
Let me just clarify on the emergency cases. I'm not sure. What we're talking about right now is a vaccine that would go first and foremost to healthcare workers and those with underlying health conditions, meaning that they're much higher risk. And that could start within days after its approval. Now, we still have to work out the glitches, you might say, with regard to how is it going to be delivered. Remember, this is a vaccine that requires to be refrigerated/frozen at minus 94 degrees Fahrenheit. That's a pretty high bar to reach in terms of freezer capacity. And then once it gets into the local areas, if, for example, healthcare workers are the leading candidates for this vaccine, if your house is on fire with COVID and your staff is so stretched, it's going to be tough trying to deliver vaccine into that. But those plans are in the works right now, and that's where I'd really see it having its first and most earliest impact.
Right. And so, Anthony, did you want to say something else?
I was going to say, you probably don't know the question, but I'm going to ask, know the answer to the question. We're going to ask it anyway. Are there, with military, local governments, are they doing things to start to bring in freezer trucks to bring into areas in an emergency situation?
Yeah, even unfortunately, freezer trucks themselves aren't going to be enough to get that level of temperature, but they are working on very specific kinds of containers that the vaccine can be put in that are supported by dry ice introduction and so forth. So there's a lot of work going on that very topic. The question is going to be is having the personnel and the organizational structure at the local level to deliver vaccine. The other part of it, which actually we've talked about before last time I was on, is just the issue of who will take the vaccine, who will trust it. And we have a lot of work to do right now to educate the public about why this vaccine is so important and what it means.
Right. That is a big concern that I personally have, sir, because there's been a lot of misinformation out there. And I'm at the point where, while I trust you implicitly, I don't know what to trust necessarily because there's been so much misinformation out there. I don't know what's right. I don't know what's wrong. I don't know if I can trust my gut anymore.
Well, let me just tell you this. I promise you, I will give this the most intense kind of look-see that you can imagine, because I'm going to be the one recommending it to my loved ones.
Right.
And to myself. So when I am confident that this vaccine or vaccines is ready to go, I'll let you know. Okay.
Thank you.
My challenge is I want it right now. Okay. But I have to wait in line like others because I'm not at the highest level risk. So I don't want me not getting it the first days to be interpreted as I'm at all reluctant. Now, I'll let people know, and I will wait my turn in line just like everybody else should. And let those people like healthcare workers, people who have severe health conditions that would mean a much more likelihood of severe disease if they get the infection. But I'll tell you, when your turn comes up, get it. Okay. And I'll make sure you know that.
Well, thank you for that. And also, there's two questions. One, will it become something that will be mandatory? And two, will there be 2 doses as far as we know right now?
Well, I can't imagine it ever becoming mandatory. I don't see that happening. I think our job is to get people to take it as is. I think in terms of 2 doses, there is one vaccine being evaluated right now, which is a single dose. And it's very possible that as we evolve these vaccines and we learn more about other vaccines that are being researched, it's possible we will have second and third generation vaccines, meaning they'll be improved and new. If we could surely get to a single dose vaccine that doesn't have the severe freezer requirements and also provides the same level of protection as the other one, hey, which one are you going to go with? And so I think you're going to see an evolution of these vaccines come forward.
Right.
No, we just. I'm sorry, Glenn. Go ahead.
I was going to say, when you were talking about the delivery mechanism, and I don't know if this sounds crazy or right on, but what about involving like Amazon or something? They've gotten so good at their infrastructure at delivering that last mile. Something like that might be a really good solution. Is partnering with private companies something that's possible?
Well, we have to take a step back and realize, the public health community as well as the medical community vaccinates, millions of kids every year. We give a lot of vaccines to adults. We've already got a lot of systems in place with private sector companies that know exactly how to do this. And so we're not needing to ask any new company that doesn't have experience moving vaccines to do that. I'm very confident that we have the infrastructure within our current vaccine systems. And that's what we need to utilize to really get us to the point of effective and rapid movement of these vaccines into the community.
Right. Excellent. So I'm also curious, we've got some good questions here. A friend of the show, Steve, is wondering, are all vaccines created equal or some worth waiting for beyond whatever might first hit the market? How do you make that determination? Because I feel like there's a lot of potential companies that are working on a solution here.
Yeah. And, as I said, we may have second and third generation vaccines that will get better, but don't wait. If you're waiting, you're putting yourself at risk. And, it may come to a point where someday you'll get one of the new vaccines, a newer version, but the old one gave you quite a bit of protection. Let me give you a case in point. We had an old shingles vaccine, how bad shingles is. And, that thing was only about 50% effective. Many of us got that one because 50% was sure better than zero.
Right.
But then along came a new one that gave us almost 99% protection. And I got that one then too. Okay. So one doesn't preclude the other. So right now, get the one you have, even if it's not the most perfect one, it still is going to be an incredible opportunity for you to protect yourself versus not being vaccinated. And that's what you're looking for right now.
Is there anything you see with the current vaccine that everyone's talking about that's concerning you? That has, obviously it hasn't been tested 100% and we still got a long way to go. But is there anything that's a red flag to you?
Nothing is a red flag. I think that there are a lot of what I guess I would call, we got to learn about it flags. And I mentioned one earlier. How long will the vaccine protect? We're going to find out that I think in months that it's probably going to require a booster at some point. And but we do that with flu every year. And that doesn't mean that it's not a good vaccine. So we'll learn those kinds of things as time goes on. And we may find out one day, maybe every 2 years, you need a booster or whatever. But nothing at all that's a red flag at this point. And, this is one thing I want to say. I want to give great credit to this administration with Operation Warp Speed. It was truly a Manhattan Project-like effort.
Wow.
And they've delivered on these vaccines in a major way. Now, our job in public health is to deliver a healthy population for which a lot of people didn't get virus infection needlessly. I don't want to come to February and March and say, oh, look at 35-40% of the population has already been infected. They don't need the vaccine right now necessarily. That's our job right now, is to make it possible for people to get to a vaccine one day as their way of becoming protected.
Where are we right now with testing? Is there a test that's going to come out that's going to be like the rapid test, but a lot more available?
I don't see one right now on the horizon. There's a lot of research going on into testing. The PCR test that we have is still a very good test. The problem has been just having enough capability to get it done quickly and get it out. That's been a challenge. So I think at this point, it's fair to say that, we surely welcome what we call point of care tests that are better. There are some now where you can do it right on site. And get a result in 15 minutes. The problem with those is we've had lots of problems with false positives, meaning you test you positive when you're really not infected, or false negatives. It says, oh, you're fine when you're really infected. We learned all about that at the White House, where they were using such a test to screen people coming in, and we saw what happened there. That didn't work out so well. And so, these rapid tests that are done at the bedside or done in your home, wherever, I have concerns about them. And that's where I'd love to see us invest much more in the way of research and development, is wouldn't it be great if I had a highly reliable test that I could take myself every day and find
Right.
out?
As passionate advocates for the hospitality industry, we talk a lot about how instantaneous results is going to be critical to getting events back. I mean, I'm sure you saw the announcement about Ticketmaster is hoping to do some sort of plan, right? So is this something that we should be hopeful about in 1 month, 6 months, 1 year from now?
I can't see what the timeline is. I know there's a lot of research going on. I think you're going to see a lot of interest and pressure in using the current point of care test for screening. But again, I'd come back to remind you of the White House. That was exactly what they did there. So you want to make sure we get new and improved tests to make this happen.
Right. Very interesting. So let me ask you, I think it's a really terrific way that you put it, a Manhattan Project. I think that really explains what's going on for us. So because of that, does that, because I'm stuck, because when a drug comes to testing and all that, it can take many, many years. But here, all of a sudden, things seem to be going much quicker. As the outside observer, it seems, my first gut is this is being rushed. Right. Yeah. So why is this not being rushed? Why has this Manhattan Project like Operation Warp Speed changed the dynamic so I and my fellow citizens around the world don't have to be concerned about something coming to market quicker than we might have thought otherwise?
It's all about this. It's about money. So what's happened is that in a very ingenious way, Operation Warp Speed was designed to do everything simultaneously, what otherwise would be a sequential process. Meaning that if I were going to do vaccine research in a otherwise different, normal setting of, childhood immunization, I would do step A to step B. I would do work in the lab to figure out, is this thing really make, antibodies in certain cell types, et cetera. And I'd go to the second step and third step. And so I'd go to A to B, B to C, C to D, D to E, D to, and each one of these would take 6-8 months. Okay. What they've done with Operation Warp Speed is they've done all of these legs at the same time. Such, however, if A fails or B fails or C fails, then everything you did downstream is a waste of money.
Right.
You wasted it. But what they did is they avoided the time crunch. So what happened is that all these different steps were ongoing at the same time. And so far, they've been really in great shape in terms, by the time they got to the end at F, you know what? It all worked. But they could do it in such a limited time period because they didn't wait for one to get finished to start the next. And I'm sure there'll be additional vaccines coming down the pike that will be that way, where they'll say, well, we got to C and it didn't work. After that, we're done. And then D, E, F, and G are all going to be wasted.
Right.
Even to the extent of manufacturing, they manufactured these vaccines early. That's why we have some vaccine right now for when the vaccine gets approved.
Fascinating.
Never happens. Usually you wait till you get approval before you start manufacturing vaccines. They've already done that.
But now that was a combination of private money and government money and private resources and government resources. Is that correct?
It is, although the government played a very, very heavy role in it. Yes.
That's great.
What does heavy role mean? Financial support, medical professionals?
Both. I mean, it was actually a situation of heavy financial support, but also then a lot of support on how to set these studies up in a timely way and be done. And there was a lot of input from the FDA, for example, and helping guide the companies as to what the FDA was looking for, how they were going to evaluate the vaccines. That was all part of it too. And so it was really a major initiative in cooperation to get these vaccines researched and made. And again, I think that's been a real success.
Are there other organizations around the world that we have not been partnering with that are also working on potential vaccines?
Yes, there's a major one called COVAX. And this is a group, it was an independent effort supported by some foundations and also by a number of governments, in which they've looked at a whole series of vaccine candidates, trying to figure out which one gives us the best results, and at the same time working on agreements to provide the vaccines, particularly to middle and low-income countries. And this has been a remarkable effort also. So, a lot of successes have come out of this issue with the vaccine so far. And what we need to do is just continue that work. We need to make sure that the public understands how critical these are. And you know what? I want to be on here someday to talk about something totally separate from COVID. And we have a good time and we laugh and everything's kind of not all that serious. That's my goal. Okay.
Well, I really love that and I appreciate it. Although I'm not so sure you're going to think either of us are too funny. We try, but we'll
I
see.
don't know. I kind of think you're very entertaining. It's wonderful.
Thanks. We're actually trying to tone it down right now today because this is a very serious issue that we want to discuss. But I'm going to take you up on that offer, sir. As soon as we're past this, we're going to have you on for a good, fun time. Anthony, you have a question, sir?
I think last time you were on, we spoke about the Algonquin. Am I correct?
We sure did.
Yeah. So when the Algonquin opens, you will get an invitation from me, and I will buy you whatever you want, because we truly appreciate not only coming on the show, but what you're doing every day, what you've done in your career, how you've really kind of been in the forefront of this for many, 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 many years. So thank you very much.
Well, then we'll go to do that, and then I'll take you with me. I actually have an agreement with one of the major theaters in New York who I have helped out in terms of understanding what they can do and can't do right now. And my price for that is being invited to an opening night concert with the 4 original Beatles.
Wow.
So I told them I'd help them out if they could, think about that. I didn't make them promise, but I said, would you think about it? They said they would. And so you can go with me that night, okay?
Well, I'll bring my daughter, and I may reach out for a favor to get my daughter a gig because she just graduated theater school.
Yeah, and while you're at it, maybe get me Hamilton tickets when they come back.
Okay.
This question comes directly from our producer. Is there an international effort of sharing information? Are we sharing info with Europe, for example, and vice versa? And I think this is coming out of Europe, correct?
Yeah, well, we are sharing, and COVIX has a large European component to it. We're sharing information with other governments. The European Medical Agency, or EMA, which is the FDA of Europe, and our FDA, often collaborate and work together, and it's been a very positive situation. So there is that collaboration going on right now, and that's also one of the things that I think is very important.
And Doctor, before we wrap up today, I want to ask you one more question about this particular vaccine. I heard that it involves some really incredible new technology where they actually can change the mRNA and slide in different components. So you're basically creating what they call a superstructure for this and for additional things that may come down the road that we haven't discovered yet.
Yeah, think of it as a platform where basically the platform is, in this case, the iPhone or the Sanyo phone, whatever, and each of the apps are different. Okay. So what you want is one thing to run it on. In this case, what this vaccine is made so that it can elicit antibody responses and immune responses overall to any one virus, whatever. And next time we may want to use it for a totally different disease. We just slip out the cassette, more or less, to say was for this one and put the other one in. And I think these platform vaccines are really going to be important going forward. And this is what we need to continue to invest in so that when we have these crises in the future, we don't have to wait nearly as much time to get the research done, that we can quickly go in and, just exchange out the cassettes and away we go.
I like the fact, because everybody's politicizing this, and I like the fact that you gave credit to what's happening in the government, and also that you're going to help the new government coming in. So, again, this is not a political issue. This is a human issue. And I think you articulated that beautifully. So thank you for that.
Well, thank you. My job is always just to call balls and strikes, and help however I can. And, if I know something, I say it how I know it. And if I don't know it, say that until I figure out how I'm going to find out. One of the things that, I'm very aware of, the older I get, the more vulnerable I am to learning. So that's been a kind of a good thing.
I've got one last question for you, sir. There still seems, and we had to block somebody on here just before that's saying ridiculous things, still buying into the notion that this may not be real. How can we explain to people without having it devolve into a whole political argument that this is a real thing and we all need to look out for each other as citizens? You know what? If I could take this audience for just 20 minutes into an intensive care unit right now in many hospitals around this country, if I could just have you spend 5 minutes
with the healthcare workers who have given everything they have, and yet they got to keep coming back day after day. They call themselves broken.
Mm-hmm.
You know, how many times can you hold someone's hand as they die and then have to quick rush off to somebody else? You know, I was on with a very prominent physician on a radio show a week ago. And you know what he remembers about Mother's Day? He remembers a family having to be outside the hospital, and he held his iPad so that they could say goodbye on Mother's Day to their mother and grandmother.
Jesus.
I mean, and that happens multiple times every damn day. And so to me, you know, when I hear this, I just say, please, if you could just know what's going on in these hospitals right now, you would never say that. You would never, ever believe that. So I think, you know, thank you for the opportunity here for me to tell this audience, this is real. This is real. I believe that within the next few weeks, COVID-19 will very likely become the number one cause of death in this country. Think of that.
Right.
That's a public health problem.
Yeah, that's grim. Anthony, and anything else?
I got chills. That's sobering statement. One of the things, and I'll let you go after this, Doc, real quick. One of the things that I've been hearing recently, I think as recently as this morning, that the virus is becoming more contagious and it's getting stronger.
You know, it's really not. There may be some evidence it's a little bit more infectious, but you know, it's still the virus that we are dealing with. It's surely not causing more severe illness at all that we can see. So I think at this point, you know, this is a pretty stable virus as such, and even recent reports about it infecting mink in various mink farms around the world, particularly Denmark. You know, really haven't borne out that the virus has changed so much to change how we respond to it. It's a pretty stable virus at this point.
And if you had the virus in April, I had my best friend who lives right across the street from me pass away, a 78-year-old, and he was one of my dearest friends. And if he got it today, under the same circumstances, would he be in a better position to survive?
Great question.
Absolutely, yes. The challenge is that as time goes on, that's going to get to be closer to no. And the reason is because these healthcare systems are just so overstretched.
Right.
You know, the expertise that has, you know, learned so much about how to handle these in the intensive care wards is being stretched to the max.
Right. So while we've learned an awful lot, because the numbers are soaring, it's making difficult for medical staff to implement everything that we've learned.
That's right. Exactly.
Right. What's happening in New York in March and April is now happening in our country. And, you know, we here in New York, we got sober pretty quick. By April, we were pretty scared. And then as we went on in our lives, because the beaches opened and, you know, it was a relatively normal summer on the beach. You know, people went to the beach, kids were out. And I'll be honest with you, I felt normal for a second. Everything's becoming abnormal again here in New York, because our cases went from, we were having 400, 500, 600 cases. Now we're up to 4,000 or 5,000. I'm going into a state on Monday for a business meeting that they just doubled the number. So it's pretty scary. So,
well, you know, that's what we talked about last time I was on the show, what was going to happen. And, you know, this is
all right.
Yep.
Virus is doing what this virus does.
Yep. All right. Last question. Last question for you. Please tell us a little bit more about your podcast.
Well, thank you. You know, it's just me talking to the world about what I've learned. You know, as I've said before, the older I get, the more vulnerable I am to learning.
Right.
You know, I just try to share with the world. These are the substantive issues of the day that we see. You know, we surely try in our podcast to share also a sense of kindness to the world. You know, we've got a dual epidemic going on here. We got one, first of all, of really, truly dangerous health issues in terms of physical health, but we've also got a mental health pandemic going on right now in so many ways. And so we try to address that too. And we welcome everyone to participate. And, you know, I'm so lucky to work with the team of people I do at the center that I work at to put this thing on. And that's what we try to do. We welcome all listeners. Please come and find it.
And I really appreciate you talking about the mental health aspect of it, because that's just as scary to me as anything else. Because I'm seeing people that I know, including myself, where it's like some days I'm just like, I'm questioning myself. I'm like, you know, I'm stronger than this. Why is this seeping in? Why am I having from time to time, trouble getting out of bed. Like what is happening? And I think, we have to, I'm trying to stay 2-3 weeks ahead of myself and really mentally strong.
Yep. Important.
But
you know what I'd say your biggest problem is right now? You're normal. You're just normal. You're like the rest of us. We're all feeling the same thing you're feeling.
That's right.
And that's what we have to recognize and address and help each other. You know what I'm going to do for Thanksgiving this year? I'm not going to expose my family members by going to get together, because it is a real risk. But I'm going to spend the day calling so many people in my life that have been so good to me and just thanking them for being born. That's
Wow.
what we need more of right now. We need days like that.
That's a beautiful way to end it. Dr. Osterholm, thank you so
Thanks,
much.
guys. Great.
Really appreciate it. We'll get you back. We'll get you back on the other side.
Good. Remember the Beatles now. We're going to go see the Beatles, okay?
All right. Awesome. Thank you, sir. Wow. That was unbelievable. I thank everybody for tuning into this very special show. What an honor it is to have somebody of his caliber, who is just named to the President-elect Task Force on COVID, join us on a show, Anthony.
You know what I get from him? I get how normal he is and how transparent he is. I love the fact that he selected to President-elect Biden's task force, but also made sure that he gave credit to what's happening in our government agencies now. Mm-hmm. And you don't hear a lot of that. You hear a lot of polarization. You don't hear a lot of, listen, this isn't about one president or another president, one government, another government. This is about your family, my family, the people that are listening to us, and we've got to cut through the nonsense. I had a conversation with a client of mine, and it was a pretty serious conversation, and we were hugging and kissing like virally. We're joking with each other, and we have two separate ways we're seeing these things, but we still came together, and we're still client, and he's still my client, and we're friends. But we need to be able to have a conversation, because what you heard right now is not clickbait. If you take one thing he said or one thing we said, you just hear that he was President-elect Biden's advisory committee. Right there, people click off and say, oh my God.
That's right.
Contest. So if you listen to the entire conversation and him giving credit to the current administration, as well as what he's going to do in the future, that's what you need to do. That's why podcasts work, because it's long form entertainment, it's long form information, and we're not just getting clickbait. Because at the end of the day, one of the things we have to remember, these news organizations and these websites have to make money, and the way they make money, and we've seen it before, Glenn. How many times have you clicked on the headline and the article has nothing to do with the headline?
It frustrates me so much, coming from a journalism background as well. I cannot stand it. Really aggravates me. But Anthony, we're talking about mental health, and I do want to let the viewers understand that coming up in early December, the first week of December, we're going to have Dr. Aaron Berman back from the National Institute of Mental Health to continue our conversation on how we could all be mentally healthy during this very trying time as well. So I'd love everybody to tune in for that particular show. That's going to be on December 1st, actually. So an easy date to remember there. Also, a little bit of levity. PJC Pockets. No, Anthony is not normal. We were just being polite.
He's Peter, who's a good friend of mine. Yeah. And Peter, that drink I said I was going to buy you is off the table. You're lucky I like your wife. And
off the table, right on him.
Yeah.
Excellent.
So,
all right. Before we wrap up, I just want to do a shout out to my fellow peeps at the Long Island Hospitality Association this afternoon, starting in just 25 minutes at 3 o'clock. If you're on Long Island, we're going to be at WBAB Radio in Babylon selling hospitality brews. 4-packs are $20, and $5 of each 4-pack sold goes to help displaced hospitality workers on Long Island. Come on by, say hello, buy some beer. Anthony?
Socially separate, my friend, and wear your mask.
Yep, exactly. Thank you guys very much. We'll be back on Monday with our regular scheduled shows. We really appreciate you listening and learning along with us today. Remember, all we ask is wear a mask. Right, Anthony?
Wear a mask, be kind to yourself, and be kind to others.
All right, be good, everybody. See you on Monday.